Welcome everyone to the second session of the APDA Northwest Beyond Medication Wellness series. This one is on the topic of cognitive fitness. We are really glad to see all the folks in the Zoom room, as well as if you're joining us on this YouTube video, thanks for joining in. This is the second part of a 4-part series on cognitive fitness. I am joined on the screen here with Dr. Karen Torres from the University of Washington Medical Center. My name is Jen Gillick. I am the program director at the Northwest chapter of American Parkinson Disease Association, who covers the 5 states of the Northwest: Alaska, Montana, Idaho, Oregon, and Washington. And then we have offices and chapters throughout the country. So Dr. Torres, thank you for being here. This is the second session, and today we are going to talk about executive function, which is something that can be impacted by Parkinson's disease. So I am going to leave, and I'm going to turn it over to Dr. Torres, and I will be back at the end to help moderate questions and answers. So thank you all very much for being here. Take it away, Dr. Torres.
Wonderful. Thank you very much, Jen. And thank you everyone for coming back to week 2 of cognitive fitness. Today's topic will be focusing on talking about executive function and how it affects the community with Parkinson's disease. So just an overview on the course. So last week we focused on talking about lifestyle factors that impact brain function. This week, we'll highlight executive function. Next week, we'll talk about mood and its impact on brain function. And then the final week 4, we'll talk about cognitive training strategies. So taking more of a hands-on approach on what you can do to keep your brains healthy with cognitive training. So we'll talk about executive function today. So some of the objectives of today, I think it'll be important to talk briefly, maybe 5 minutes, about the assignment that was suggested for all of you after last week's talk. Then we'll launch into this week's topic, following which we'll have an open discussion again, to be moderated by Jen. And then we'll talk about a suggested assignment for this week, and we'll meet again the following week. So to get started, last week's suggested assignment. So we talked about lifestyle factors and how they are important and pivotal and can really, really impact your brain function. And so I suggested that you journal and really take note and just maybe become more mindful of how much exercise you're already doing, what kind of diet you're engaging in, where it can improve. And certainly, tackling on the issue of sleep, if you're sleeping poorly, if you're sleeping well, what do you know? How do you feel? How does it make you feel? So, if anyone is willing to share their experience of maybe just thinking about these issues for the past week, I'd love to hear them. So if anyone wants to share, raise their hand or unmute themselves. We're all ears. All right, Michael. Michael, would you like to share? Michael Sullivan, you could unmute yourself.
Can you hear me now?
Yes, we can hear you.
Yeah, I didn't do too well on diet and exercise. I've had a problem with shortness of breath, but sleep is terrible for me. And ended up, I don't know that it's just due to Parkinson's. It's gotten worse. I've had problems over the years, but I just got a new Apple Watch, and I'm kind of like 20% sleep disturbed. I'm trying to think what day it is. Tuesday night, I end up getting up every hour, and it's not just to go to the bathroom, but and the next day I was just horrible. I was dizzy and something else going on. I ended up going to the ER. But yeah, I'm really struggling with sleep, and down here in Tacoma, it's so hard getting any help at all medically. So I'm waiting to see a sleep medicine specialist in June.
Okay.
But yeah, it
Ha-
just really, and I think it's affecting. I'm a grumpy old man, is all I can say.
Well, sleep is important for a lot of aspects of your brain function, like we talked about yet last week. If we don't sleep very well, the next day we tend to feel pretty poorly. Not only are we tired, but we can be grumpy, or maybe a little bit more irritable, even sad. We may eat more, eat less. Thinking is less clear. So this is why sleep is so important, because it impacts, multiple aspects of one's life. And so I'm glad that you will be meeting up with a sleep specialist to talk about your concerns and see how they can help, most definitely. Thank you for
One,
sharing, Michael.
one thing, if I could add, I had been diagnosed with sleep apnea many, many years ago.
Mm,
Had a CPAP. I got rid of that when Philips had a recall, but the this Apple Watch that I have, and there's some software I've added to it. You can turn on the sounds, and it tracks your snoring and everything. And I really have pretty minimal snoring, and it's not detecting any big gasping of air for sleep apnea. So I don't think it's sleep apnea that's waking me up. So that's something
mm.
I'm probably try to print that out and share it with a sleep medicine specialist.
Absolutely. And that's good planning because they will ask you questions about your sleep. And now you can present them with some evidence of what your Apple Watch has been telling you. But certainly, going to the sleep specialist will, make the definitive conclusion, hopefully, of whether or not sleep apnea continues to be a problem for you or not. So that's great planning ahead of time. Anyone else who would like to share? Okay. Well, thank you for anyone who engaged in the suggested assignment. It's really these assignments at the end of each talk are more like encouragements of, just let's start thinking about these things and, maybe really, really being mindful of the things that we're doing, the things that we're not doing, and certainly what can we do to improve. It doesn't have to be a big, significant change. Small steps are meaningful. Small changes are meaningful. So, Michael, you said you didn't really get into exercise and diet, but you thought about your sleep. And that's the important thing is that you started thinking about it. So, thank you, everyone. All right. So we'll launch into our question for the day. What is executive function? Do I have any volunteers who would like to share what they think executive function is? And if no one does, that's good too. That's why you're here. All right. So executive function, it's an umbrella term for all of the cognitive abilities that belong to the front part of your brain, your frontal lobe. And so executive function includes things like working memory, your ability to plan, your ability to think flexibly, how well you organize, how well you initiate tasks, and certainly what kind of strategies you use to complete tasks. So the question is, executive function in Parkinson's disease has been shown to be one of the most common cognitive impairments for people with Parkinson's disease. And indeed, one of the earliest cognitive difficulties that people with Parkinson's disease experience. Some studies have suggested that people who are newly diagnosed with Parkinson's disease already are experiencing difficulties with executive function. And specifically to Parkinson's disease, the different types of executive dysfunction that exist includes things like thinking flexibly, cognitive switching, things like your working memory, planning and initiation becomes more problematic, and certainly things like making big decisions. So it is a big problem for people with Parkinson's disease. It is a very common problem. And perhaps one of the problems that may get more mistaken for memory difficulties, which we'll talk about a little bit later. So why is there executive dysfunction in Parkinson's disease? What does the frontal lobe have to do with Parkinson's disease? Well, we know that the anatomy of how Parkinson's disease affects the brain helps explain why the frontal lobes are affected. So Parkinson's disease, what happens is there's a depletion of dopamine, okay? And the dopamine is generally produced in this area here of the basal ganglia, which is deep inside the brain. But the basal ganglia has loops that go from the basal ganglia, that may go through the thalamus, and then to the frontal lobes. So if there's a dopamine that is being depleted in this area of here, the basal ganglia, the pathways are going to start malfunctioning, okay? And it's because this pathway is being disturbed that we tend to see more frontal lobe or executive functioning difficulties in Parkinson's disease specifically. Okay? So when we look at different types of executive difficulties that happen in Parkinson's disease, one of the most common is working memory difficulties. And working memory, what is it? It's the ability for you to take in information, manipulate it in your brain, keep it there, make changes as your environment changes, and then keep it within the memory context. That sounds really challenging, right? Because it's not just taking in information, but you're being asked to rearrange it, organize it, etc. That is the executive piece. And so examples of when we need working memory, let's say we're working off a recipe and there's all the ingredients and then there's the steps. Step 1, combine 2 cups of water with 3 cups of flour in a bowl. You go to get your ingredients ready to do this, and then you forget. How many cups was that? What was it? What kind of flour? So that specifically is working memory, reading the instruction, then moving on to executing it. But then the information and the details get lost because working memory wasn't strong enough to keep it in your brain for that brief period of time, okay? Another example is, let's say you're, balancing your checkbook and you have quantities of numbers that need to get added. So you see it on a piece of paper, you go to your calculator to punch in the numbers, and then you forget. Those numbers kind of go away. So you kind of have to revert to rereading what was on that paper before transferring it over to the calculator. So that is working memory, being able to hold several pieces of information. Some scientists say you should be able to hold 7 bits of information, so 7 numbers, 7 words in your head, plus or minus 2. But I think more realistically, and the strategy that is important here is that realistically, it should be around 5 bits of information that you should be able to keep in your head to be successful at working memory. So how do you do this? How do you train your brain to get better with working memory? Or if you have working memory difficulties, what can you do to adapt? What can you do to improve this? Certainly, one of the most important strategies is to organize your space and eliminate distractions is the number one. So let's go back to that example of the recipe. Ideally, it would be best for you to gather all of your ingredients in front of you before getting started, so that going back and forth between the recipe list and your ingredients, grabbing baking soda, grabbing flour, it's all in front of you. So a more organized space will help your working memory be much more effective. Eliminating distractions, clutter, irrelevant information. And irrelevant information can include someone being present and talking to you about other things that are not related to the recipe at hand. Talking on the phone and working on a recipe can be too challenging, right? That multitasking aspect of it. So let's simplify. Let's simplify your environment or of wherever you're completing this task, and that will help you being able to keep in bits of information as long as possible. Then we have the issue of set shifting or cognitive flexibility, which is your ability to modify and change your behavior in the face of the changing goal or demands or the environment. And this ability is essential for problem solving, for being able to adapt, for being able to multitask. So an example comes up, you're driving home from, let's say, a hospital, and you have your route in front of you, and then now there's a detour. And the detour is taking you off the highway onto street roads. And this may become a little bit difficult because you may have difficulty with, thinking of alternatives in the moment, right? Some of us may get frozen, some of us may go blank. So now what do we do, especially if the signage isn't so great? Another example is, changes in medication regimen. You've been doing your medication for, let's say 6 months, and it hasn't changed. And suddenly there's changes. There's more of this, there's less of that, or none of that. And so that requires a change of, how do I fill my pill box now? Do I need another slot for, let's say, a noon dose? How am I going to remember? So this all requires mental flexibility, shifting your brain from how it's used to doing something or how it was expecting to do something, and it's requiring you now to do it differently. So that's one of the areas that is most challenging, or can be most challenging, for people with Parkinson's disease. So what strategy can we use to improve this? Planning ahead of time. Especially if let's say you're driving to some place that you don't know very well. Let's say you're going to a new hospital, and you look at the paperwork and it says park in P1 for the closest parking option. You get there and P1 is closed, or P1 is full and there's no more parking. So thinking flexibly would require you to do what? Look for signs around the hospital, which may not be so intuitive. Looking at a map. When does one have time to look at a map while they're driving? So planning can go a long way with helping that difficulty with shifting your set in the moment. The day before, you can start thinking, okay, they tell me to park in P1, but let me take a look at this map and see what other alternatives for parking there are if P1 is full. Okay, because it can happen. So just being familiar with the general area, or taking a notes, making notes of, okay, P2 is on this street between this and this. So planning ahead of time can really, really, really help with trying to help you think more flexibly, especially in the moment. Same with, your medication regimen. Okay, let's take a look at the big picture and let's plan. How are we going to change this? Let's take notes. Let's see what works. Let's see what doesn't work. So planning can go a very long way. Some difficulties that people with Parkinson's may have is that the strategies they use to complete tasks are inefficient. They're difficult. It makes completing the task a little bit more difficult. So, when we do assessments here of cognitive abilities, executive function also includes how someone completes a task. What strategy do they use? So, for example, on some tests, people may struggle with making a lot of errors, and specifically the same type of error over and over again, even though, let's say, the evaluator is saying it's wrong, let's try something else. it may be difficult to try something else, right? Because the flexibility isn't there. So trying the same thing over and over again. Or they may make the types of errors where they're just making errors and not catching them because they just want to get through the testing, or catching their errors, which is important. A learning approach can also be influenced by inefficient strategies. So sometimes if you're at the doctor and they want to test your memory, they give you 5 words and they say, repeat these 5 words. And then 10 minutes later, they'll ask you again for those 5 words. An inefficient strategy is trying to learn the list of words in the order that you hear it. So that's serial clustering, taking in information in the order that you hear it, versus a better, more successful approach that taps into executive abilities is semantic clustering, organizing these words in your head. Okay, how do they make sense? There's some buildings there, there's some colors there, or if it's like a building and a flower, how can I relate these? So the semantic clustering tries to make a connection between the words, but you need executive function to do this, to be able to take in this information and try to learn it in a way that is meaningful. So talking a little bit more about errors, we talked a little bit about the types of errors that people with Parkinson's disease may be more prone to making. Perseverative errors is kind of trying the same thing over and over again, having difficulty modifying or switching to a different approach. But there's also losing set type of errors, in conversation or during a task, suddenly losing your train of thought and having to be kind of rerouted to the topic or task at hand. It can definitely impact, following a treatment plan, for example. So these type of errors make task execution a little bit more challenging. And it's because the executive aspect or the executive piece of your memory, of your cognitive functioning is weaker than expected. Okay. So strategies for flexibility, again, planning ahead of time, thinking of alternative solutions, writing them down, exploring each one. It's essentially what I talked about. Let's go ahead and think about alternatives ahead of time before we're being asked to think about alternatives in that moment that is already stressful and can already be challenging. Planning is also difficult, can be difficult for people with Parkinson's disease. Your ability to identify and complete all aspects or components of a goal. So let's say planning a trip for overseas, getting ready for an important medical appointment. This requires planning for it to be successful. But the idea of planning for a trip overseas on your own can sometimes feel overwhelming because where do I start? What do we need? Where are we going to go? What kind of hotels do we want to stay? All of these options become so insurmountable because it's thinking about it's a big project. So planning can be difficult, and it's easier to just say, oh, you figure it out. I'll leave it up to you. Go ahead. But one way to really, really address challenges with being overwhelmed with planning is breaking down the task to all of the different components of it. Getting a sheet of paper, writing down your goal and figuring out, okay, what are the steps I'm going to need to reach this goal? And writing each, I know it sounds painful, but writing each step down one by one will be important. Because one, by breaking down the task, you become aware of what you'll need. You'll need these materials. You'll need this type of information from the hotel, for example. But it can also help you think ahead of time of potential obstacles or things that may derail the planning. So you can think about it ahead of time. And that's really the key, is becoming more aware of potential hypothetical situations that can derail you derail the plan. But it has to be broken down to the bare bones so that it makes it much more feasible and easier to do. You know, you're checking off each thing you're accomplishing, which makes you feel great. You know, it's that reward system of, oh yes, I've completed this. Let's move on to the next thing. That helps planning be executed very, very strongly. Initiation can be a big difficulty in Parkinson's disease. You know, it's the ability or desire to start a task. You know, last week we talked about, oh yeah, exercise and diet and sleep. And there was a small assignment, and then, well, how do I get started? Where do I start? You know, if you have a home project, you know, you've always wanted to, you know, garden flowers or have a rose garden or something. You know, it's starting to get nice outdoors. So when do I start planting my tomatoes out? You know, these tasks that require a lot of initiation. So who's going to start? Well, you have to start, right? So you have to start somewhere. And again, and you'll notice that there's a theme here with all of these different types of executive abilities, that planning will be your best friend. Planning out the materials necessary, planning out the steps necessary in front of you so that you have a strategy for approaching these tasks. Not only helps you complete them, but it helps you to get started. Because ideally, when you're planning out a project, you'll begin to transfer all of the steps into a calendar. And it's not about overloading your calendar with this project alone. One day you can take step one, the next day you can take step two, and you're checking off each of the steps required to do it. So that if you wake up in the morning and you have this goal in front of you of a project, but you still haven't thought about how to do it, you're not going to do it. It's not going to help with initiation versus when you wake up in the morning and it's on your schedule that at 11 a.m., you're going to drive to the nursery to buy soil. Great. You'll do it, you'll check it off, and the next day you'll complete a next part. So planning is key. Planning is key for increasing your ability to initiate new tasks. But we can't talk about initiation without apathy, because apathy affects initiation. So apathy in Parkinson, and we'll talk about apathy further next week as well, but I felt the need to mention it for this discussion as well. Apathy is quite common in people with Parkinson's disease. And apathy can definitely contribute to decreased levels of motivation and emotion, definitely initiation, you know, directed activity or goal-driven activity decreases because the desire is not there, the interest is not there, certainly. You know, you may start off on a project, but then quickly lose interest or desire to continue. People with apathy may go on to just be more comfortable leading a more sedentary life, watching television, being unbothered. But we know that that's bad for the brain, right? We talked about last week about how activity is the key to having a healthy brain as long as possible. But apathy here is definitely an obstacle towards that, okay? So one of the ways that we can address apathy is finding ways to increase motivation in everyday life, okay? From a behavioral standpoint, while there's certainly medications that, you know, if you talk to your doctor and they feel that your apathy is too severe, they can prescribe medications or other treatments to help with the apathy. But from a behavioral perspective, the best thing you can do to try to combat apathy is developing a routine in your life. And I know routines maybe sometimes have a negative connotation because there's very little room for spontaneity or or dealing with things in the last minute. Routine and having a routine as part of your life is the key to increasing motivation. Similarly to what I discussed about initiation, you need a plan for your daily life. Waking up without having anything to do or anything on your calendar makes motivation a lot less. It decreases it significantly. So I think it's important for you to incorporate a schedule into everyday life, because a schedule holds you accountable. It tricks your brain into saying, well, I have to do this. It's on the calendar. But again, the important thing is not to overwhelm your calendar with exercise and socialization and new project. No, we want to start this gradually. So having a few things in your day that you're going to be able to complete and check off is a pretty significant motivator. So having increased structure is important. Having a routine, breaking down steps, doing all of this makes behavior much more automatic. It makes it much less burdensome or overwhelming, because it makes it like it's achievable, that you can get it done. Because motivation is a big factor when you're thinking about how it could potentially impact mood, right? It's a bidirectional relationship. People with apathy may do less in their daily life, and so they feel guilty about not doing much or relying on other people to do these things for them. But certainly, if there's very little motivation, that can lead to your mood being very poor and maybe exacerbating apathy and depression. So motivation is definitely a behavioral intervention that anyone can do, and building routines into every life is a key motivator to getting things done. Okay? So a little bit about motivation and depression. Certainly, like I mentioned earlier, if motivation is related to severe depression, severe mood symptoms, then talking to your doctor, they may recommend psychotherapy or medications that can help this. But it's something to consider if you're doing as much as you can to improve your motivation and initiation, and it's still not helping, then definitely looking for other explanations or other interventions can be helpful. And if you are a care partner, if you are a care partner who's joining us today and you are living with someone with Parkinson's disease who is struggling with these executive difficulties, these frontal lobe difficulties, then it's important to help. And in what way can you help? Helping making decisions better, helping bringing alternative solutions to problems that may be difficult for the individual to come up with themselves, but also limiting options. Sometimes there's too many options in life. Where do you want to eat today? That's a big question for a lot of people. Or what do you want to eat? I don't know, especially if someone's apathetic. I don't care. Do you want to eat steak or chicken? That can lead to a more attainable goal. It's like, okay, well, this is what I'm feeling. So limiting options is important. Helping the individual develop structure and a routine, at least initially, can be very, very helpful, because again, for some people, it could just seem like an insurmountable task. And helping them plan as much as possible, thinking about roadblocks and whatever you're doing, and trying to figure out how can I minimize these will lead to less frustration when these roadblocks show up and these unexpected obstacles do become present in whatever one is doing. All right, so before we get to the things for next week, I will stop sharing and open to questions or any comments from anyone who's willing to share with us today. we're open. So maybe for the next couple of minutes, we can talk about anything you've tried or any questions. So, and I know Jen will help us with this.
That was great. You were talking, and I was listening to some things, and I wrote down you were talking about something, and I was like, I'm going to ask her a question about how apathy relates. And you absolutely touched on that topic. So I crossed that off my list. So we have a question from David in the chat. Could cognitive behavioral therapy be effective in reducing apathy, depression, motivation, etc., as it relates to Parkinson's?
Absolutely. So it really is. So cognitive behavioral therapy can be very, very important and effective because it's very goal based, right? So there's an issue that you want to talk to about or resolve. So what if the issue is, I'm just disinterested in life. I can't figure out what I want to do. I don't know what to, how to fulfill my life or, find meaning. And so that can be the topic for you in cognitive behavioral therapy. And with the therapist, you'll develop a plan because cognitive behavioral therapy is meant to be time restricted, not just go on forever and ever and ever, but it could be 10 sessions focused on the specific problem, figuring out, okay, strategies, some of the strategies that we've talked about today, but you get homework after each session. So you think about strategies, you go home, you practice them, and the next week you talk about what went well, what didn't go well, and you move forward in your goal. So I think cognitive behavioral therapy can be excellent, not only with executive function, but anxiety. If you have a specific anxiety about a specific situation coming up, addressing that, learning strategies, and moving forward. So it'd be a great resource.
I don't know if you remember, but when we have an 8-week program at APDA called Press On. It's brand new. It's for people who have been living with Parkinson's a little longer, like five years and more. And you were with us one of the sessions, Karen,
Yeah.
and there was a woman in there. She's in her 80s, and she had just started cognitive behavioral therapy because she was struggling with sort of a little bit of apathy, but really just keeping her attitude more positive and not losing hope and all of these things. And she was like, I went into this and I'm like, I'm an 80-year-old woman who you're not going to teach me new tricks. Like, this isn't going to work for me. And one of her assignments, and she just raved about cognitive behavioral therapy. And one of her assignments was every night she would sit down and she would write one good thing that happened to her during the day. And she wouldn't just write it down and just let it be there. She would email it. She had chosen a friend. She would email it to that one close friend who also would email that back. And she said, lo and behold, it really helped after a while. I just started looking more on the bright side. And she's like, I never thought something so simple would be so helpful. And it was just really a direct piece of like, this is your homework. This is what you're going to do. And it made a difference for her.
And it goes along the same lines of, the theme that we've talked about is like just being mindful. Let's take a moment and think about, how things affect us and what we can do, what's within our power to change it. So that's a great memory. I remember that well, Jen.
Yeah, delightful. Jim, you've raised your hand. You want to unmute yourself and ask your question?
I'm unmuted. So this great presentation, Dr. Torres. Really appreciate it because I could relate and see all of those patterns and situations applying in my situation. What's interesting is next week I'm going to be going in for, I'm just going to call this a cognitive psych eval at Overlake Clinic to sort of get a baseline on like how am I doing at this point in my life. And I don't know if you have any comments about that, but it seemed like your presentation was very appropriate to the kind of thing they might evaluate in a cognitive eval.
So, Jim, I perform those evaluations here at Harborview.
Maybe I'm seeing you, but you're at Harborview, no. And I'm going to go to Overlake.
So I'm not going to give you the 411 on how to do this test, but You're exactly right. These are the areas of cognitive abilities that will be evaluated. So, if I could recommend a baseline evaluation for everyone, I would, but it's not possible, right? But having this baseline will give you kind of like a chart of where are you strong, where you may be weak, and specific recommendations on how to improve on anything that is weak. So it's a wonderful thing that you're doing in getting this evaluation, because you'll get more information about how you're doing and what you can do to improve in any areas of weakness that you have.
Yeah, I agree 100%. That's why I'm doing it, to get a scale, where I'm at, and then, maybe in a few years, where how have I progressed or declined, or whatever. Because I haven't had Parkinson's long enough, only about a year, year and a half, so I can still remember when I didn't experience any of the issues or situations that you talked about in terms of cognitive function. And so that's part of
Yeah.
my, I don't know, the disparity that I feel. I still remember like how I used to be and how I am
Mm,
now, and I can tell that there's a difference, but I can't quantify it
yeah,
exactly. It's very
yeah.
frustrating.
But hopefully you'll get some information that can be helpful for you, because like I mentioned, the cognitive difficulties that exist in Parkinson's disease show up early on in the disease. You don't have to
Mm,
wait years and years with the disease. They may be present to some extent early on, but the important thing is that, you identify what it is so that you can work on it and adapt, and really, really, try to change, future with Parkinson's, because it's still possible. Having a healthy lifestyle is a key, but also knowledge and awareness is important as well.
thank you so much.
I see, Michael, I see your hand is raised. I'm going to go to a question in the chat, and then I'm going to go to you, Michael. We will send out the slides, but can you briefly touch again on the set loss errors that you spoke about?
Yeah. So, sometimes when people are performing a task, let's say you're writing an email, right? You're plugging away, talking, and then you're like, in the moment, you're like, wait a minute, what was the point of this email? What was I going to talk about next? What is the real issue here that I wanted to address after the formality of, hi Jim, how are you? So that's a set loss error, is when your train of thought gets interrupted and you need to find a way back to where you started. So kind of retracing your steps. So that can happen a lot more in people with Parkinson's, is, losing that set of the task that you're doing. So this is why interruptions are not your friend when you're struggling with being easily moved away from the task at hand. So minimizing interruptions can help decreasing the likelihood of losing your set during that task that you're focused on. Because if the TV is on the background and you hear something, you'll catch, they'll say something about like the Eiffel Tower, and then you're like, what? And then you're coming back to your email, your set is lost. So minimizing as much as you can, key.
Thank you. Michael, your question.
I'm kind of like Jim. I've been diagnosed in the last 11 months ago. My wife passed away 8 months ago, or
Mm,
9 months ago. I'm coming to terms with that, but I really feel adrift. I'm stuck between two healthcare networks.
mm,
Not because I have Medicare and Federal Blue Cross. I have very good insurance, but just I was diagnosed with a neurologist who didn't really, when I finally asked for some suggestions and where to go and get more information, he said, well, I really don't know. I don't treat Parkinson's patients very often. And so fortunately, I found you folks, and I've
mm,
learned a lot. I'm not on dopamine right now. I'm finally got plugged into a movement disorder specialist. I won't see him till September. That's with Multicare. The Franciscans, because I now have a referral to another network, they their policy is they won't, if they won't see if you're being seen by another neurologist. So I guess the question I have, I finally got plugged into a counselor at Multicare because I'm beside myself. But I'm wondering about you didn't mention anything. Does dopamine, if you go on that, does it help the cognitive functions?
So I'll tell you this. So earlier I mentioned how at the time that people are diagnosed, some of them may already have deficits with their thinking, executive function, memory, and so forth. And some of these folks go on are diagnosed with mild cognitive impairment. At the same time, they're diagnosed with Parkinson's disease. But some studies have shown that once the symptoms of Parkinson's disease are treated with dopamine, for example, their thinking can improve because their off periods are minimized, right? They may be sleeping better because their motor symptoms are being treated. And so when they're reevaluated, their memory doesn't look so bad. Their thinking doesn't look so bad. So yes, there is evidence that perhaps starting treatment can improve aspects of thinking that are problematic, but not for everyone. So it's different, but the possibility is there. So yes.
Okay, thank you.
What other questions are out there from the audience? Feel free to type in the chat or raise your hand or just unmute yourself and shoot away. Got a couple more minutes left. And one of the things that Michael was talking about with the loss of his wife is also not underestimating the power of grief in cognitive function, and that just a Parkinson's diagnosis is an aspect of, there is a grieving process that one goes through with diagnosis, as well as then you add on other things in life, like the loss of a wife or a family member or something like that. So, you know, we talk a lot just giving space for that and making sure just to acknowledge that is part of this process.
Absolutely. And part of, oh, sorry, someone wanted to say something.
Oh, someone's going to unmute.
I don't know how to do the hand, but I just wanted to say to Michael, I mean, I was diagnosed like 7 years ago. So I've been on dopamine. My voice is being affected mostly lately. But I find that with depression or apathy, it occurs when I'm off my med, when my med is weaning off. And then once I take my pills again, I feel so much better. It's like as the med is weaning off, I can almost feel like a gray veil sometimes just descending on me. And there'll be times like that where I have things planned for the future, a trip or just an activity. I think I'm not going to be able to go. I can't do it. You know. And then once I get on my meds again, so that might really help him to start on the dopamine and the levodopa. Yeah, hopefully.
Thank you. Thank you for sharing your experience. It's very helpful. Thank you. Any comments on that, Karen?
No, but I agree. And next week, when we're talking about mood and how it affects the brain, we will talk about this relationship that exists that's bidirectional, right? Because not all cognitive symptoms in Parkinson's disease are related just to Parkinson's disease. Certainly, if someone has significant depression or anxiety, that can contribute to thinking difficulties as well. So we'll talk about, again, strategies to help alleviate some of those symptoms next week.
Great. Linda, you just raised your hand.
Hi, thank you. I really appreciate you talking about the planning bit. It's interesting. I was inspired to start doing that type of planning myself because it helped me to alleviate the anxiety of having to remember everything, all the steps to a process. And if I plan it out, I usually start at the end result and plan backwards so that I get a good timeline. I don't have to think about like how long it's going to take to do one thing because I've already done that, and I can look at where it needs to happen, and it alleviates a lot of stress and anxiety for me. So I just wanted to share that, hopefully as an inspiration for folks.
Thank you for sharing that, Linda. And you're absolutely right. The unknown can be scary for people, especially when it comes to something big, like a big project. And so some of us may be, frozen by anxiety of, this seems scary. I won't be able to do it. I can't do it. And so by planning, you're exactly right. It helps alleviate some of that anxiety related to being able to complete tasks. That's wonderful.
So there is I see, Jim, I see your hand up and I'll come to you in a second. There's one question in the chat. Can SSRIs negatively impact levodopa?
I have not heard of, but I'm not a medical.
You're not a psychologist. You're not,
no,
yes.
A psychiatrist. I'm a
Or
psychologist.
psychiatrist. You are a psychologist, yes. Other
Not
way.
a psychiatrist, but ask your medical doctor about any potential, interactions between them. Yeah.
There is on the APDA publications area, there is a medications that are used in Parkinson's pamphlet, and there's also a medications to be avoided in Parkinson's pamphlet. So if you're curious about that, you can go to the publications area of our website and take a look at that. But definitely go to your doctor and talk about those counterpoints, or your pharmacist.
Yeah.
Pharmacist can be a great resource for that as well. Jim.
Hopefully I'm okay with 2 questions today. So a long time ago, when I was more into fitness and doing bodybuilding, I took a over-the-counter called creatine. And recently I've seen some very interesting research about creatine and memory function and reasoning ability. Have you heard anything about that, especially for Parkinson's?
No, I have not heard of that. Jen, have you heard of that?
I haven't. No, not that specifically.
Okay, thought I'd try.
Yeah.
I can't find the hand raising button. Can I speak?
Yes, go right ahead. It's okay. Just
I can't figure out where you get the little hand to stick to raise.
I think it's under reaction.
All the buttons. I have found that I used to be a really multitask kind of person because I was a teacher and you had to be aware of the guy in front of you and the kid in the back of the room and what's coming up next. And I did that all the time. And now I can't do multitasking. I've been diagnosed about 5 years now. And sometimes my brain is so scattered that getting it to focus it's just, I can't seem to accomplish anything. And what I found that helps is if I lock myself in one room at a time, because I do only the chores that I can do in this room. I don't do anything that's going to take me to another room because that's going to distract me and I'll go down another path and forget what I was doing. And so if I keep myself in this room till I get these jobs done, before I let myself go to the living room, or before I let myself go to the kitchen, especially before I let myself out in the garden, because then I'll never come back in. And so just physically isolating myself seems to help a little bit with the distractions.
Absolutely. And sounds like you're focusing on one task at a time, which is a good strategy when multitasking
Never done that before in my
challenging.
life. I used to just always bounce up because I knew by the end of the day I'd have them all done. Because I don't always bounce back to wherever I started, but I don't bounce back anymore.
But it sounds like you found a way to adapt, and that's the important thing, which is great.
Thank you.
New strategies. Yes.
Yep. All right. So let me go back to the presentation so that we talk about, let's see. Okay.
And Karen, I wanted to just say thank you for including a slide about what your loved ones can help with this, because that's also very practical. I also suffer from the, what do you want for dinner? And my husband always says pizza or sushi, but giving a choice is so much easier. So I love that you addressed that. Thank you.
Absolutely. Sure thing. Okay. So for next week, let's set a plan. Think of a project, think of a goal you want to accomplish in the next month. It could be little, it could be big, just pick one thing. And practice. How am I going to plan this out? Write down the steps necessary to complete the task. Come up with potential obstacles that may come up in your planning. And set this in a calendar. Small steps across the next few weeks. Think about how can I make this achievable for me because everyone's life is different as far as potential limitations with time, with mobility. So think about how I can achieve this one goal. And we'll talk about it next week for whoever is willing to share. Okay. And just a reminder for next week, we'll talk about mood, common mood symptoms in Parkinson's disease, how mood can present as an obstacle towards brain health in Parkinson's disease, and definitely strategies for improving mood symptoms. Okay, that's all I have. Thank you, everyone, for being here.
Thank you, Dr. Torres, very much for a great program. Everybody is going to get a post-event email on Monday. I will send that out. But remember, you've got some work, which I will remind you of on Monday, that if you choose to think of a task and come up with some strategies, please do, and we'll report back next week.
Thank you.
I'm going to stop the recording, so thank you for joining us.
Thank you, everyone. Have a